Everyone, my group and I will be presenting on the Joint Commission. The Joint Commission is an independent, nonprofit organization whose main purpose is to accredit and certify various healthcare organizations. The mission of the Joint Commission is to inspire organizations to continually excel in providing safe, effective, and quality care.
The Joint Commission was founded in 1950 by four main associations: the American College of Physicians, the American Hospital Association, American Medical Association, and the Canadian Medical Association. The four became a team and created the Joint Commission on Accreditation of Hospitals, also known as the JCAH. The purpose of forming the Joint Commission was to create an organization that would oversee and accredit healthcare facilities to prove their quality of care. It would inspire organizations to voluntarily strive for accreditation status, and which would prove the organization excels in providing effective and valuable care. To appreciate the Joint Commission and its valued mission, it is important to know the significance to the word joint. Joint means to combine, share, or mold together. It is the act of bringing two or more separate puzzles and combining them to form a puzzle. The Joint Commission is truly a joint effort from the various associations that founded it. It was an act in which different associations joined together to create a revolutionary commission that would strive to improve quality of care in healthcare facilities.
Is to help improve patient safety and outcomes and to accredit healthcare facilities. But what does that mean? Accreditation is the process of officially recognizing someone as having a status or being qualified to perform an activity. In healthcare, accreditation is a voluntary process organizations put themselves through to document and prove the quality of care they provide. Accreditation is not easy because it involves numerous qualifications and survey requirements. However, once accreditation is granted, the organization receives a seal of approval, which is a tremendous accomplishment. To demonstrate the importance of accreditation and how it can impact patients, I want to share a personal story. One morning during our early morning scripture study, and while my daughter was serving a mission in the Philippines, we received a call from Salt Lake City. On the line was the mission president and Elder Packer. Yes, it was a heart stopper. My daughter Janae needed surgery on her foot, but she didn't want to come home early from her mission to receive the surgery. The mission president told us she could stay to receive the surgery and assured us the hospital in the Philippines was a great hospital. We knew he was a doctor, and he specifically said to us on the phone that it's a Joint Commission accredited hospital. There was an immediate understanding that the hospital was up to standard, which made it easier to give the go-ahead. That was the first time I learned that the Joint Commission accredited hospitals outside the United States. And in fact, that's a fact that I greatly appreciated at that moment in time.
Currently, the organizations eligible for accreditation are hospitals, home care facilities, nursing homes, behavioral treatment facilities, surgery centers, and doctors' offices. Accredited medical centers also can have additional Joint Commission certifications within their programs of care for diabetes, heart disease, and total joints.
The following statistics come directly from the Joint Commission's website. Out of all the hospitals in the United States, 77% are Joint Commission accredited. And out of all the accredited hospitals in the United States, 88% are accredited by the Joint Commission. Specifically, Joint Commission accredits approximately 4,168 general, children's, long-term acute, psychiatric, rehabilitation, and specialty hospitals. These are significant numbers that prove Joint Commission is a valuable asset to healthcare.
At least every 3 years, the Joint Commission dispatches a team of healthcare experts. Usually, that team includes physicians, nurses, life safety representatives, and others to conduct an on-site, unannounced hospital survey, which includes interviews with senior hospital leadership, doctors, which are the medical staff, and nurses, and even at times patients if they agree. The survey involves a tracer method, which is tracking a patient's hospital stay and following the course of treatment from wherever it originates through every department of service that touches that patient anywhere in the organization. On the next slide, you can see a sample survey agenda for a survey that a hospital would go through. And right off the bat, you can tell that it's a lot. There's a lot of people involved, and it's just intense. This is an actual sample survey that's sent to hospitals when they find out that they're going to be surveyed. Surveys take anywhere from 1 to 3 days, depending on factors such as the size of the institution and whether or not it's a full survey to receive deemed status or a specialty certification survey. It begins by the Joint Commission posting on their website by 7 a.m. what facilities they will be surveying that day. The survey team arrives and it's announced overhead so everyone in the hospital knows that they're in-house. As you can see on the schedule, there are opening conferences, daily briefings that involve all leadership, including doctors. The most intense is the tracers. It's the clinical portion of the survey. The survey team, in one of their preparation sessions or planning sessions, they pick from a patient census report a patient that they would like to follow through the facility or trace through the facility. Every person or department that's involved with that patient is now intimately involved in the survey. The surveyors will want to review the physician's credential file and every nurse, lab tech, or other person that works on that patient's HR file. They look for trends, the surveyors look for trends and patterns, either negative or positive, on everything you can imagine, including hand washing to operating room techniques, appropriate licensure and board certification to governing board approved privileges for the provider to do what he's doing. The life safety survey on the right hand of the screen is the plant operations side of the survey, which happens at the same time the clinical survey is happening, and it includes everything physical to the hospital, from elevators to fire safety to stuff being stored in the hallway, and the list just goes on and on. You can kind of see some of the things on the agenda there. And at the end of the conference, there's a closing conference. You can't see it on here because it's actually on day 3 on the survey. There is a closing conference for administration, and the survey team lets administration know what they've found during the survey. And then there's a general meeting with the survey team for all the leadership in the hospital rather than just the C-suite. And they give a preliminary findings report to the entire team. And at that point, there's really no surprises because the Joint Commission works with you all the way through the survey. And anytime you can see on the schedule the special issue resolutions, they're bringing issues to you and saying, what about this or what about that, and how do you handle this, and how would you fix that, or anything like that. So it's really a working survey to improve patient care and quality outcome. What is deemed status? Healthcare organizations that want to participate and receive payment from Medicare and Medicaid programs must be certified as complying with conditions of participation, or COPs as they're called, or standards set forth by federal regulations. The certification is based on a survey conducted by a state agency on behalf of the Centers for Medicare and Medicaid Services. However, if a national accrediting organization such as the Joint Commission has and enforces standards that meet federal COPs, CMS may grant the accrediting organization deeming authority and deem each accredited healthcare organization as meeting the Medicare and Medicaid certification requirements. The healthcare organization would have deemed status and would not be subject to the Medicare survey and certification process because it has already been surveyed and accredited by another organization that Medicare approves of.
So the years listed on here for each organization are not necessarily the year that they became a business, but it is the year that they could start accrediting healthcare facilities. The competitors to the Joint Commission would be Detnorsky Veritas Healthcare Incorporation, Healthcare Facilities Accreditation Program, and Accreditation Commission for Healthcare. The Joint Commission differs from their competition with price, complexity, prestige, and goals. The price and complexity with being accredited will increase if the company chooses the Joint Commission. With the newer competitors, they have the opportunity to provide a quality service at a lower cost. The Joint Commission has unannounced surveys every 3 years, and for some companies, that can put a great deal of stress on their management and employees. Their competition, such as DNV, offers the solution of yearly visits that can be scheduled and planned for, but this does not necessarily overlook the prestige that comes with being accredited by a company known to be the gold standard for accreditation. With that said, the competition varies with some of the standards that they set, and it can be easier for some companies to meet standards of the competitors. The competition also will have different mission statements and goals, and these can be important to the leadership of these healthcare companies and ensure that they line up with the goals and mission statements that they have made for their business.
So why would a hospital be accredited by someone else? There are a few main reasons why a hospital would choose to be accredited by someone else. It is very expensive to become Joint Commission accredited. Accreditation costs include 2 fee components, an annual fee each year and an on-site fee, which happens every 3 years during the survey. In addition, the requirements and qualifications a facility must complete to become accredited requires teams of committees, hours and hours of labor, and continuous data collections. The costs quickly add up. Another reason is due to the long list of requirements. Becoming accredited by the Joint Commission is a continuous, difficult process that requires serious commitment. Unfortunately, some healthcare organizations are either not able to commit or unwilling, which is why other accreditations appeal to them.
The Joint Commission is considered the gold standard of healthcare. That stands for the excellence and quality in patient care. Behind every gold seal of approval is an organization committed to quality. Accreditation has many benefits that ultimately create a safer and more efficient healthcare organization, increasing patient satisfaction and treatment. The continued and loyal goal of the Joint Commission is to promote rigorous standards of care and to provide solutions for achieving peak performance. Thank you for watching our presentation and have a wonderful evening.